Hi, I'm Dr. Victoria M.A. I'm a board certified plastic surgeon in Scottsdale, Arizona. Today we have our lovely patient who is 4 days out from a breast augmentation. She chose to have breast implants placed over the muscle in the subfascial plane. So that subfascial plane is a layer that sits on top of the chest muscle. And part of the reason for that is that she didn't want her chest muscle or her pectoralis muscle to be cut during the procedure. And she also didn't want any risk of an animation deformity. An animation deformity is basically where the muscle pulls the implant up when the chest muscle flexes. This patient has a little bit of baseline asymmetry, just like most of my patients. So generally speaking, most breasts are sisters, not twins, and that's normal. This patient's left breast was somewhat smaller by about 30 cc's, and so we actually placed two different size implants. These are a moderate high profile in the Mentor Boost implants. So she had some asymmetry of where the crease was on each breast, which is normal. So we wound up bringing this crease down just a little bit to match her right breast. And in doing so, the top of her breast implants better match. It's important to understand that because everyone has asymmetry, we do our best to try to give the patients as much symmetry as possible. So to do so, we will often make these tiny tweaks during surgery, such as lowering the fold or choosing two different size implants, just to try to make the appearance of the breast more symmetric, even though they are two different breasts. This patient also has sutures that are reinforcing along the bottom and the sides underneath each to help hold that implant in place where we want it to be. She did not have any mesh placed because her implant is not greater than about 400 cc's. That's around the range that I start to really recommend having mesh placed, especially in patients that have lost a lot of weight, which this patient has not. The other thing to note that when I talk to patients during their consultation is that this distance in between is the distance of your sternum. And we know that this is where your breast naturally sits on each side. We don't want to violate that center area because you can have a risk of those pockets connecting, and that's called symastia or a uniboob. So we have to respect where that natural barrier sits. The other thing to know about this patient is she is post-op day 4. She returned to work on post-op day 3. She has very little pain. I do use Exparel during these breast augmentation cases and most of my breast cases. So when I put in the Exparel, I actually put it all the way around the breast on each side, which is why you can see a little bruise up here. Now that Exparel helps provide pain control for 3 days after surgery. So it's just starting to wear off in her, and she's only taking Tylenol and ibuprofen. The patient's doing great and very happy with her breasts so far, and we can't wait to see how they settle and heal with time.